Welcome and thank you for joining us this morning for Issues and Views, Buffalo, New York's weekly public affairs program focusing on topics and concerns that affect you and your community. We hope the information you hear today is beneficial to you. Now here's your Issues and Views host, Todd Anderson.
Good morning and welcome to Issues and Views. I'm your host, Todd Anderson. We have two guests with us today. From Roswell Park Comprehensive Cancer Center, Odochi Uwazurike, and he is the project coordinator in the Survivorship and Supportive Care Department at Roswell Park, and also Dr. Linda Bopin. She's the director of Adolescent and Young Adult Cancer Program and physician in the Division of Pediatric Hematology and Oncology at Roswell Park. Now, April 1st through 7th is National Adolescent and Young Adult Cancer Week, also known as AYA. And Dr. Bopin and Odochi will discuss how important this week is and what will be offered to AYA patients and their caregivers at Roswell Park this week. They'll also provide information about resources for AYA patients and how they can be their own advocate and how they can manage their long-term care after treatment and fertility preservation. And welcome both of you to Issues and Views this morning. Thanks for coming.
Good morning. Thanks for having us on.
Now, we've identified that the first week of April is National Adolescent and Young Adult Cancer Week. Tell us more about this week and what it's all about.
So this is a nationally recognized week that has been increasing attraction in the cancer world and hopefully among the general population. The National Cancer Institute designates an adolescent and young adult as anyone between 15 and 39 years of age, which is actually a pretty broad age range, and that's really quite recognized that we're really looking at anyone from teenagers up until, early adulthood. And at Roswell Park, our AYA program tries to focus on those between those in their 20s and 30s, as we have a pretty robust pediatric service that can kind of cover the needs of the teenagers. So really this AYA Awareness Week is important and needed because over the last several decades, we've learned that our adolescent and young adult population really haven't seen much improvement in their survival rates compared to the pediatric and older age population. And it's just more in recent years that the AYA field has emerged as another patient population within our cancer world. And we want to just increase more recognition for this population because they have different needs, as you can imagine, than children and the older adult population. And this week kind of gives us the time and the attention, both locally and nationally, for this patient population specifically.
Yeah, you don't think of up to 39 years old as adolescent. How did they come up with these ages, or this age group?
You're right, and I think that's why that young adult portion is tagged into that AYA, and it's because when they looked at data nationally to see how our improvements in cancer care was translating to this age group, we noticed that over like a 20-year period from the 1970s to the 1990s, when you looked at what kind of improvement are we making annually on survival rates in people with cancer, and when you looked at age groups, it was really those between 15 and 39 that was quite starkly different than the children and the older adults. And so it was that seminal paper that came out actually showed, and this was in the early 2000 year, I think it was 2003, it actually showed that this 15 to 39, there's something going on in this age group that we're not seeing as good improvement rates as the older and younger population. And we're still trying to really grasp at what is it about this population that we're not seeing this improvement in survival rate change.
Are there more prevalent cancers in that age group?
So, for instance, the most common cancer that you see in this AYA range is breast cancer. Although the flip side is when you look at breast cancer world, this population makes up a very small proportion. So to put it in another way, there's about 70,000, just over 70,000 AYAs who will be diagnosed with cancer annually in the United States. This makes up probably about 10% of all new cancers across the country. So though this is a small number relative to the more common population, which in the United States tends to be those who are over 65 years of age, we're talking about, close to 75,000 people annually who are diagnosed. And what's important is that these are not individuals who who only have, maybe 10 or 20 years left of life. But these, we expect that they should have a long life ahead of them. And the implications that their cancer and the treatment will have long-term is something that we also want to focus. That's a little different. And so the cancers that they get most commonly is breast cancer. But the other ones that are common in this age group are melanoma, testicular cancer, thyroid cancer, and lymphomas and leukemias.
So it's primarily women.
Yes. Yeah, it definitely primarily women if you look overall across all AYAs. And you certainly can now look at different age groups within AYA, and that what kind of most common diseases that you see will vary between those, in 15 to 25 and then 25 to 35, I'd say, and then over 35. So there are some variations even within the AYA range.
Yeah, that's interesting because we, I think a couple of weeks ago, we did a program with you guys regarding breast cancer. The recommended age for mammogram is 40 and older, or
it
50?
Yep, you're right. And that's why I think it's important to note that breast cancer is still very rare among young women. However, if you just look at AYAs, it's kind of one of our more common cancers. So it's something not to be ignored. And what we do know in breast cancer, while we stay on that topic, is that among young women with breast cancer, they seem to have a poor prognosis for factors that we're still trying to understand.
So I think that's the importance of National Adolescent and Young Adult Cancer Awareness Week is to bring to light all these individuals who are being diagnosed with cancer at such a young age range. Because I feel like a lot of people don't normally think of teenagers or people who just graduated college or in college or just starting their career as cancer patients. A lot of times we do see pediatric and elderly patients, and I think individuals who are in this age range are often forgotten. And so this week is to let them know that there are other individuals between that in those age ranges that are cancer patients and cancer survivors, and also to let them know that they're not alone. There's also a lot of resources out there for them to take advantage of.
Now, why is it harder for them to get diagnosed?
As a young adult, I don't think when they have an illness, cancer is at the top of their mind, as it shouldn't be. Common things are common, and I can't stress enough that for anyone listening to this, cancer is still rare among this population, so I don't want anyone to get necessarily scared. And I think also on the flip side, I think physicians who are seeing young adults, whether it's in an urgent care or in their offices, it may not be also at the top of their differential diagnosis when they're presenting with an issue. Again, because common things are common. We're still trying to understand the nuance of why there's a delay, and I think some of it may have to do with their access to healthcare. Certainly we are seeing changes in the Affordable Care Act and who's in care, who's covered with insurance and who's not. And there have been some publications that have shown that there may be this challenge with who has health insurance and that impacts when they may seek attention and treatment for some symptoms that they've been having. So I don't think it's one reason necessarily as to why there may be a delay. I think it's, again, a multifactorial process that we really need to learn more about, try to bring more attention to, which is, again, helpful with this AYA week, and something that we need to monitor as we see the changes in the National Affordable Care Act come into play, and what does it mean for this population.
Now, what should an adolescent do if they do think something's wrong?
Right now, and certainly this year, flu has been a big attention, so I'll kind of maybe focus a little bit on that. I think when you're feeling like you have fevers and aches and pains, and certainly symptoms that go with a cold, and knowing that you're around some sick people, I think flu is what is common. I think what you need to be more concerned about is when these symptoms don't improve in the time period that you think it's going to. I think everyone, especially in this age group, we're learning a lot more about our bodies. And when something doesn't seem right, don't be shy. That's my only message. Try not to be shy about it. If you go to a college, there's a health office nearby. You can always go to your pediatrician up until you're usually about 21 if you haven't, transferred over to an adult care physician. And there are urgent centers around the country if you don't have a provided primary care physician. So there's a couple of messages there. I think if you get sick, but it's lasting longer than you think, go get attention. I think as you get to know your body, we do urge, as pediatricians, we urge our younger population to start examining themselves monthly, testicular-wise, and their breast tissue also. And though we don't do mammograms until you're 40, the advice is that you should start actually doing self-exams, and that those are hugely helpful. So when you do feel like something is maybe not quite right or you question it, monitor it and seek attention. And I think that, you are your own advocate. We're learning that this age population is definitely independent. We're learning, about these so-called millennials. They're very different than previous generations. And I can't stress enough, use your knowledge and use your contacts and get seen for anything that you think might be an issue. And even if it turns out to be nothing, that's okay, right? That's the best case scenario.
Yeah, it would seem that in that age group, if something is wrong, people probably think it's going to go away because they're so young. That's probably right. One of the challenges, right? Right,
and we've had actually some young adults tell us that even their own, physician, while they're getting worked up, is, you're so young. There's no way this could be cancer. And it is very true. It is rare, but it does happen. And I think we need to be on the lookout that cancer does happen among AYAs, and we just need to kind of be more aware of that.
Now, is there anything this age group can do to prevent or to reduce their risk of getting cancer?
Yeah, I think the area of cancer prevention is only going to continue to grow. And what we know for this population in particular is we all know smoking's not good for you and it can cause cancer, period. We know that the e-cigarettes, we're also learning a lot more about that as well, that it's not a safe alternative necessarily, and that we should try to avoid that as well. Across the country and certainly in New York State, we have learned that suntanning, the suntan beds, the commercialized, and suntanning in general, is harmful and does increase your risk of skin cancer and should be avoided. And also, we're very fortunate to live at a time when we have the HPV vaccine that does help prevent certain cancers. The HPV vaccination has a lot of controversy for some, but the bottom line is there's been a lot of research in this, and it's very helpful, and anyone who can get it should.
Now, in terms of tanning,
I think if anything, people should be aware to use SPF when they go out in the sun.
And what is that? I have no idea.
Oh, it's a sun protectant cream. There are different types of different numbers, like SPF 15 is in a common lotion, and 30 and up to 50. And I understand that actually over 50, it's probably not as effective. So no need to go to like those SPF 75s or 80s.
All right. So SPF 15?
15 or 30, yes. And you do have to apply it every couple of hours because you can't do it in the morning. Wow. And it won't just last all day, unfortunately.
Okay. Well, that's good to know. So if an adolescent is diagnosed with cancer, what resources are available to them?
So at Roswell Park, we have a wide array of resources available to our young adult cancer patients. We have our young adult program, which is a support program for our patients, and we offer psychosocial support, peer support, for our patients and survivors at Roswell. If they are interested in signing up to be a part of the program, they could visit our website at www.roswellpark.org/young adults. And at our program, we offer monthly workshops and support groups. And those are an opportunity for our patients and survivors to meet with other young adult patients and discuss their experience, whether that's related to their diagnosis, their treatment, or returning to work and school, financial toxicity. This is a forum for them to meet other young adults and share those experiences with other people who understand what they're going through. In addition to that, we also do offer social events. So those range from month to month. We have done Bills games. We've gone to concerts like Drake and Rihanna. We do a lot of restaurant nights, and it's just an opportunity for patients and their caregivers, whether that's a significant other or parent or sibling, to just kind of take a step away from the daily grind of cancer treatment, and just to have some time just doing normal date night or fun things that are just going to get their mind off of diversionary activities, that are going to get their mind off, hopefully get their minds off of their treatment experience.
So the most direct means of more information regarding this is roswellpark.org/young adults.
Young adults, correct.
Okay, great.
We also have a Facebook page.
We do have a Facebook page. Yeah, you can check out our Facebook. It's www.facebook.com/Roswell Park AYA. And on there, we share different links to articles about young adult cancer articles, and we share upcoming events, stories about young adults in our community, and what we have planned for our young adults as well.
Now, among this age group, this is kind of the baby making age range. So fertility comes into question, especially with testicular cancer, right?
Yep, surprisingly, a lot of cancers. So testicular, definitely one of them, as you can imagine, because Can
you still produce a child if you have testicular cancer? Are there some dangers?
So you can. It all depends on what your treatment is. Actually, a lot of we give a variety of chemotherapy for all these different types of cancer types, and there are certain chemotherapy agents that will increase someone's risk for not being able to have children, whether you are male or female. And it all kind of depends on which chemotherapy you receive, how much of it you receive. And also for some, it's the disease where their cancer is. So for some testicular cancers, you absolutely can have children afterwards. It depends on how extensive your disease is, how much treatment you need. And for anyone, regardless of the type of cancer you have, I think it's important to have a discussion before treatment starts, preferably about what your risks are in terms of will you be able to have children after your cancer treatment has been completed.
Is there an increased risk for the child to have cancer?
So there isn't. A lot of this data comes from long-term survivors of pediatric cancer. There is a national study that's been going on for many, many years, decades actually, and so they have very good data on survivors of pediatric cancer and what their pregnancy outcomes and offspring outcomes for men and women are, and asking that very question: are they at increased risk of cancer, which they are not? Are they at increased risk of birth defects or development issues, and they are not? And if anything, some of this data showed that women who may have had some pelvic radiation or certain types of cancer involving the abdomen and their pelvis may have had maybe more premature babies, but overall they were fine.
So at Roswell, obviously everything is comprehensive. So you guys can help out with in this area of fertility, right?
Yes, we do. Our young adult program, one of the clinical efforts that we have in place is an onco-fertility clinic. This is a term that's fairly new as well, and it focuses on exactly this, the risks of fertility and family building before and after cancer treatment. And our goal is to try to meet with young adults to talk to them about what their risks are. And there's actually measures you can do before treatment starts to kind of preserve their fertility. And so we kind of call that fertility preservation. And as you can imagine, for a young man who's going through therapy that may impact their fertility, they can certainly pursue doing any sperm banking, where they freeze off their sperm sample. And we collaborate with Buffalo IVF Institutes, and we're able to help them with that. There is a small cost associated with any fertility preservation, but our program is fortunate to have some funds from the Roswell Park Alliance and help offset some of the costs. When you're talking about young women, it's not as easy to do. There is more of a time factor because you do need to stimulate their ovaries to try to get their eggs matured and be able to also retrieve them, and you can also store them and freeze them away as well. And with that, the hope is whether you have frozen sperm or eggs or embryos, even for that matter, that after treatment is done, you'll be able to use them. So, we are talking a lot of more reproductive medicine and technologies, but there have been many cancer patients and survivors who were able to pursue having biological children this way. And it's I think what we've learned is that for all of us, having children is an important factor for many people's lives long term, and so we'd like to continue to offer that for our cancer survivors for sure.
Now, when AYAs or adolescent young adults beat cancer, should they continue seeing their oncologist? Or is it pretty much over with?
Yeah, so I think a common misconception is that when you're done with your treatment, that you walk out the door and no more follow-up is needed. But there's been evidence that shows that we want our patients to continue to follow up with their oncologists. And actually at Roswell, we do have a new initiative. It's called our Survivorship Initiative. And the goal behind our Survivorship Initiative is that we want our patients and our survivors to live healthy lives holistically during treatment and especially after treatment. So we don't want to just have our patients forced out the door when they're done with treatment. We want to continue to follow with them. And we actually have a multidisciplinary team that can meet with our patients and discuss any issues that they might have after they are done with their treatment. So whether that be side effects from their treatment or long-term effects, whether that's psychosocial support that they might need, or even if it's like nutritional consults that they might need after they get done with treatment. We have a team in place that will meet with them and assess any of these issues that they might have and actually work towards solving these issues. We also have an integrative medicine team at Roswell, which offers acupuncture, acupressure, aromatherapy, healing touch, a lot of different integrative approaches to holistic and healthy well-being for our patients and survivors.
I think what we realize is that our survivors, even after treatment is completed, they may have long-term effects from the treatment that they received. Many of them continue to have fatigue or pain or just what we've heard is just some ongoing issues that kind of never went away after the treatment is done. So some of the services that Adochi has mentioned, such as the integrative medicine, is really to help with offset some of the side effects. But I think it's really important to recognize that our survivors, depending on what type of treatment they received, are at a health risk in the future that we need to continue to monitor for. And that's what we hope that our survivorship initiative and clinic will help cover. So, for example, many young people, and I should say older adults as well, may receive a type of chemotherapy called an anthracycline, which is doxorubicin or daunorubicin, that may impact their heart long term. So they may benefit from having an annual echocardiogram, depending on how much of this drug that they received, so they can A, recognize the risk that they may have, and B, know that they have symptoms, what it may be related to. And so the goal is that even an annual visit after you've completed therapy and you're out of that more active surveillance period where your oncologist is still monitoring for how your disease is responding. We want to long-term continue to follow with our patients, especially our young adults who have many, many years ahead of them, to make sure that they continue to have healthy lives and that we can watch out for them. This population is at risk for secondary malignancies, especially some skin cancers that we need to look out for. So these are just a few of the examples of what we want to offer in our survivorship clinic visit.
We actually have a litany of support groups that are offered at Roswell through our quality of life grants. And so our support groups range from general cancer survivorship support groups to caregiver support groups for caregivers who are caring for cancer patients and their survivors. We have a young adult support group, breast cancer support group, a young breast cancer support group for women diagnosed under the age of 40. We have a lung cancer support group, a lung cancer caregiver support group. So there's a wide array of peer groups out there and peer support for our patients across the spectrum of their care.
Okay. The first week of April is National Adolescent and Young Adult Cancer Week. So outside of this program, what are you guys doing to acknowledge this week?
This week we're going to be posting information about young adult cancer patients, facts about young adult cancer survivors, and the goal is to raise awareness about young adult cancers. Like you said, it's just a week now, but we're hoping that, as more people become more familiar with young adults and realize that there are young adult cancer patients and survivors, as we raise more awareness, maybe we do eventually get to a month. We'll also be doing a young adult social event, a dinner for our patients and their caregivers. And so there will be a social media campaign. And we're really just trying to, get the word out there for people to recognize this group.
Yeah, it's good information because outside of today, you never really think of this age group as having cancer. It's usually younger children or older adults.
So, even our young adults have told us exactly that. They will go through their treatment and be in either an infusion room or go to radiation, and they'll be the youngest person in the waiting room or in that infusion clinic. And they will be even remarked by the older patients that are there saying, oh my gosh, why are you here? You're too young for this. Or they may assume if they're coming with a parent that they're actually, the parent is the one who's the patient and not them. So I think the misconception is that it doesn't happen to them. I think for any young adult who's listening out there, I think the misconception for them is that they're alone in going through this. I ask anyone who's listening to try to think about when someone is diagnosed with cancer, and if you were a child, you would come to Roswell and be seen in our pediatric clinic. So you have one place to go, basically, in one center. When you're a young adult, you can basically have 5 young adults who are diagnosed, but they have 5 different diseases, and will walk through those doors and will never see each other because they will go to their respective treatment center, as they should. And what we want the message to be is that we know you're out there. We have our program, and we would like to connect with you so that you all can connect with each other, and we can show you the resources that are carved out for you.
So if there's someone listening right now between the ages of 15 and 39, you are considered an adolescent, a young adult. Within that age group, what types of symptoms would a person look for that would prompt them to come forward and see someone?
So I think if you're, I guess as I said earlier, the types of diseases that you see across AYAs does vary. So some of the things to be mindful of is if you have weight loss that you really haven't been trying to, if you have anything called night sweats where you get very sweaty at night during your sleep typically, and we're not talking just like that hot summer day where we've all probably had where your neck gets a little moist and it's
about sweating like
it's sweating. They're described as drenching sweats, and the patients that I've had certainly do describe that. It's such that it wakes you up. You feel like you have to change your pajama top or your bedding or your pillowcase. So it's not subtle. And certainly the weight loss also, I'll mention that again. If you feel general fatigue and no improvement, if you have certainly anything like bruising or something that looks like a rash, they're little red dots on your skin, but it's actually not a rash. It's a type of bruising called petechiae, nosebleeds that suddenly are happening, headaches that don't go away. I guess I can't stress enough if there's symptoms that you feel like, gosh, it should have gone away. I've had this for like a week or two and I'm not getting any better. You got to get checked out. Some patients notice after an injury that they have like a bruise or a bump that also never goes away. And it actually might be coincidental that they injured that area to bring the attention to that bump or something. But that could also be a concern. So again, watch out for it. If you have any pain that wakes you up at night, I think that needs attention. If you see anything on your skin that's unusual, lumps, bumps, any moles that look unusual, don't hesitate to just get it checked out. Again, I can't stress enough. If it turns out to be nothing, that's fabulous, right?
Right.
But just come forward and show that.
The website is roswellpark.org/young adults.
Yep.
Okay, and you mentioned 2 phone numbers.
Yeah. There's if they're interested in if they have just a general question, they can call 1-800-ROSWELL.
Okay.
And for any current Roswell patients or survivors who are interested in setting up a survivorship consult with our team, they can call 716-845-4800, and they'll actually speak with our survivorship clinic liaison, Jill, and she'll be able to get them an appointment.
And the email address you mentioned was AskRoswell
at roswellpark.org. AskRoswell@roswellpark.org.
Okay.
It's a general email that anyone who has any inquiries can shoot an email, and they will get in touch with us.
Okay, great. That seems to cover everything.
Yeah. Oh, and we're on Facebook too.
Oh yeah, Facebook. www.facebook.com/Roswell Park AYA.
Okay, so that Facebook page is specific to that that age group.
Correct.
Yes.
Okay, great. Well, thank both of you for being here today.
Thank you for having us.
We have been speaking with. I'm going to say your name right. Odochi.
There it is.
Odochi Uwazurike.
Yep.
Okay. And Dr. Linda Bopin, thank you very much for being here with us today from Roswell Park Comprehensive Cancer Center. And thank you for listening.
The views, opinions, and comments expressed on the program are those of the participants and not necessarily of this station.